Hey everyone, Jeff from Lewis Physical Therapy and Sports Rehab here. A little bit of a different topic today compared to what we normally talk to about, baseball, sport injuries. And this is going to be more geared towards our non-athletic but active adult population. And that is really the kind of concept of training as we age. Anyone that, has known me or I talk to or whatnot, training is a big part of my life. It is a big part of a lot of the active adults and patients that I see, whether it is from they have their own personal fitness goals or they are using training as a way to allow them to do whatever else they need to in life. So what I want to talk first and foremost more than anything is that this is going to sound conservative in certain ways. And I feel like sometimes when people see some stuff like this, like, oh, you're promoting, people being fragile and this and that, that's not the case. I am more so promoting people to be able to, live their life the way that they want to move good, to feel good, and just kind of all that goes along with that more than anything. And again, a lot of this is pulled from my personal experience, but by personal experience, I mean not only myself, but just from the trends that I've seen in a lot of the patients that I treat in terms of trends I've seen that lead to certain injuries in certain areas in certain body parts over the others. So really the first thing that we want to be mindful of, and this is really, we'll just say, as we age, we'll just say once you get north of 30 more than anything, is respecting your past. And what I mean by that is respecting the past injuries that you've had. A lot of times you have people that were very competitive in high school or college. After they're done with their athletic career, they're obviously their overall activity for most people typically goes the other way. And then they get to a point where they want to go ahead and get back in shape and back to what they were doing. But we have to be mindful of, if you had certain traumatic injuries in the past at certain body parts over the others, like those injuries don't go away. And what I mean by don't go away, not that they're still painful, but once you have that in your past medical history, that is your past medical history, and we want to be mindful of it. So if you had, let's just say, let's say in college or whatnot, you had a traumatic knee injury, whether it is ligament reconstruction, you had a pretty significant meniscal repair, things like that. There are just things that we know where, all right, when we're starting to get back in the groove of things, we're going to be very mindful of ramping up our plyometric impact-based work, very deep knee flexion, squatting things. Not to say we're not going to do it, but we are going to respect what has happened so that way we can start training and continue training. There is nothing worse than be like, all right, I'm going to start training. You get 3 weeks in, boom, something pops up. Now you have to throttle back, and you just find yourself in this cycle of on and off, on and off, on and off. So, and there's a lot of reasons that go into that, but that's mainly what we want to be mindful of. We want to respect the past. We can't just neglect what has happened from an injury standpoint more than anything, and find ways to be mindful of that. And then, okay, how do we address that in your program? Maybe more from a warm-up and a prep routine, and then be mindful of that as we kind of slowly ramp up into it. This next part here is important. So your prior training volume, and by prior I mean whether it was 2 years ago or back when you were training as an athlete in high school or college, does not and really should not equal your current training volume. So the kind of classic thing we hear is someone saying, God, I feel like I can't train like I used to. I can't recover like I used to. And immediately when people, start saying that or thinking that, they think that there's an injury at place. Maybe sometimes there is, but that honestly is not, it's not surprising or should not be surprising. Like, yeah, you should not be able to, majority of people, not everyone, but like, you should not be able to, and it's likely normal that you can't handle the same training volume that you did when you were 15, 20 or whatnot. Because by the time that we're probably talking about here, as we're getting older, there's other stresses in life. There are jobs, there are families, there's financials, bills. There's a lot of other stresses that go into play here, and all of that is going to be competing for that bucket of recovery that you have to pull from. So that's just an important thing to say of like, don't just jump right back into the old training volume you used to. That is immediately how you get hurt within a short period of time starting after that. So again, a lot of this, and we're going to find, it's going to come back to this last point down here, is finding a training volume that works for you. I would say for most people, 3 times a week lifting is plenty. And the other days of the week, you can kind of fill in, you can fill in with certain gaps, whether it's, hey, are you just walking one day? Are you doing a little bit more mobility? Are you maybe doing some very light kettlebell stuff on those days, or just kind of your more accessory type work? So that is something we want to be very mindful of. And the other side of it too is like, I know for me personally, I don't have time to train for an hour straight, multiple days a week like I used to back when we were in college. It's a matter of like, hey, if it doesn't get done in 25, 30 minutes, it doesn't get done. So naturally, the volume is going to be a little bit less unless you're doing some more density type training, but even still. So that's something to be mindful of. And that goes in our next part here, the challenges of recovery and adaptation. So, when you're going for, trying to really lift at a higher volume, higher intensity and whatnot, you have to allow time for recovery and adaptation. Typically, we will go a 3-in-1 loading schedule, so we wave them up for progressive intensity while volume is dropping for 3 weeks, and then we drop off on that 4th week, which you call it, deload or download, whatever you want to call it. We're still training, but we're dropping likely the training volume or training intensity or a little bit of both significantly, maybe 20-30% compared to the prior 3 weeks of loading. So that is why we do that normally in an athlete standpoint. Now, in certain cases for some people, you might only be able to go a 2-in-1. Maybe you can do a 3-in-1. Maybe you can do a 4-in-1. But what I'm getting is you have to allow time for recovery and adaptation. And again, in general, I would say for most people, you can get 3 times a week of lifting, and then you kind of find all the other little stuff you need to support those 3 times a week of lifting or your sport, whatever you're doing, to allow you to recover from that standpoint. So it's a big piece of managing variables. So number 4 here, high velocity movements. So we want to, more importantly, and a lot of this is just being smart. So the high velocity movements more than anything. This kind of comes from a lot of the tendon injuries we see of the individual that hasn't sprinted in 10, 20 years. The minute they go to sprint, they blow out their Achilles or their hamstring or quad tendon, anything like that. Or, say you're picking up a sport again for the first time, whether it is pickleball, anything like that. You take one quick step in one way, and boom, you have a tendon injury. So the high velocity movements we want to be mindful of is really coming from the tendon side of things more than anything. You do not want to have a traumatic tendon injury. Things happen, but historically, I kind of go into the assumption of if someone hasn't really done sprinting, any kind of intense, kind of high velocity movements like that for some time, you could just bank on the fact that their tendons are probably not going to be able to withstand that high velocity. Tendons are like springs. They need to be able to absorb and dissipate energy. And if that tendon cannot do that, that tendon gets overloaded very quickly. And this is where we see a span of tendon injuries, whether it's from a reactive tendon to the kind of tendinopathy, disrepair, degenerative tendons, and the worst case scenario is the rupture. So again, this is something we are very mindful of. I'll give you a perfect example. There's a lot of kind of talk now in a good reason, in a good way, of people wanting to get back to sprinting, after not sprinting for 10, 15 years or whatnot. For these individuals, I would strongly encourage you, do not start with static starts into a kind of acceleration position. If anything, you're doing rolling starts, but honestly, more than anything, keep it upright. Yes, you have to be mindful of other things from a hamstring standpoint and whatnot. But for most people, I would rather say, hey, say you have 60 yards. Take 30, 40 yards to gradually in an upright position to build up to that intensity, and then a higher intensity, not necessarily a full-out 100% drop in the hammer, but to just a higher intensity. Most people, in my opinion, don't need to necessarily be doing all-out max effort sprinting. You can just go from kind of some sub-maximal runs to some higher intensity runs. That's probably going to be enough for most people. But what I'm getting at is I do not want people doing a kind of quick stutter step or quickly coming out of a static position. That is going to be very large amount of stress on the Achilles. And it's not necessarily maybe like immediately that first rep, but it's that kind of accumulation over a short period of time that can very quickly overload those tendons. So that's kind of where I kind of talk about the high velocity movements of being smart, box jumps, things like that. Like, again, I'm not saying to not do that. I'm not saying that at all. There are just certain things you want to take into consideration. And most importantly, this last part here, there's a lot of nonsense on the internet. And I don't claim to, by no means do I claim to have all the answers. I'm always learning. You should always be learning. But I think the important thing here is find what works for you in this last part here and avoid the noise. If you find, hey, this split, if I do these 2 to 3 programs over the span of 4 months and I rinse and repeat that for essentially 3 cycles throughout the year, so 12 months there, and that works for you, like you feel good, you move good, you can maintain good lean body mass, it allows you to do the other things you want to do, whether that is, hey, are you a master's athlete? Do you want to just be able to move around with your kids, your grandkids, just feel good when you get out of bed in the morning? Like, that's the most important thing here. Like, I'll be the first to tell you, like, people that I have come in, if I have adults come in with shoulder pain, and they've never Olympic lifted a day in their life, well, I'm not going to have them start Olympic lifting. Like, it just comes down to what works for that individual. And honestly, there's plenty of times where what I think would work for an individual doesn't actually work for them. So we just have a conversation. Hey, what do you think you are going to need in this situation? What has worked for you? And maybe it's not what I'm thinking, but we go with it and it works for that individual. So that is the most important thing. And it's very easy for us to find, oh, wow, we've been doing this, it's working great, but here's this new shiny object that's all being talked about on the internet. Why don't we try that instead? Hey, you know what? Why are you working three times a week? You should be lifting 5 times. You go get stronger and whatnot. and then you end up just getting burnt out and overtraining and things like that. So again, this is very, very person dependent. But I like to have that point be made on there because that's what guides all this more than anything. Really at the end of the day, no one cares whether you get to a point where no one cares whether you train 3 to 5 times a week. It's more a matter of what puts you in the best position to achieve whether it's your fitness or your life goals more than anything. And listen, only lifting 3 times a week, if that allows you to turn the dial for what you need to, it leaves you more time to do other stuff. Whether it's, hey, you like going on walks with people, you like going whatever it is. Like, that's very person dependent. Like swimming, running, whatever. So again, these are some very just general items and kind of areas I like to cover when we talk about just training as we age. And that is very much a continuum and a spectrum more than anything. But it's important to realize that these are important things to be mindful of. It is normal if, say you're 30, 40, or 50, that you can't handle the same training volume and intensity that you did when you're 15 or 20. That is normal. I don't agree with people saying like, oh, you should be able to train like you did back when you were 20. Like, there is such a thing as risk reward, and that is a little bit arbitrary at times. But when you work with enough people, you just find certain things that work better for the general public and general individual over others more than anything. So again, this is more just to kind of get you thinking. This is not a clear cut, you have to do X, Y, Z or whatnot. This is more just kind of get an idea, see how it applies to you. If you have any questions on any of these items we covered, drop them below in the comment section and subscribe to our channel for more content like this.